Okay, so it is 7 o'clock a.m. Eastern time. I'm here in Boston, so that is the start of our class time. So I will get our program started. I'd like to introduce myself. My name is Allie. I am a doctor of physical therapy as well as a nationally certified Pilates instructor. I've been practicing in Boston for the last 5 years, and I recently opened my own practice. I've also had the opportunity to teach with the Community Online Academy since it started in the middle of March. So this program has grown a lot. We're trying new things each and every week. And in fact, you guys are getting to experience a little variation on my typical back pain class today, which is the back pain specific to sciatica. So we are going to be talking about sciatica this class. And that does not mean you don't have to have sciatica to take this class. A lot of different back conditions can also benefit, but we will talk about sciatica specifically. So this class is 30 minutes. It's going to be mostly movement based, but if you've taken my back pain class before, this class is going to go over a little bit more specifically about the symptoms and management of sciatica. And I will leave time for Q&A at the end. I do also ask that if you guys have a moment to stick around at the end of class to leave feedback for this program. I'd love to know what you like, what you didn't like, and how we can continue to make this program better. Hi there, Robbie. Good to see you. All right. So when it comes, one thing I also want to highlight with this program, and this goes for all of my classes, is that you know your body better than I do, and even sciatica, we'll get into it, is different from person to person. So please, throughout the movement part of this class, listen to your body and take modifications if needed. This class is also not meant to be a replacement for a consultation with your doctor, with a physical therapist. Everyone is dealing with something a little bit different, so I do recommend that you have that consult, but take this information to help you, through this time at home when we may not have as easy access to our regular medical care. So with that being said, sciatica refers to the sciatic nerve. And the sciatic nerve is a nerve that runs from our low back all the way down to our feet. It originates from the nerve roots L4 all the way down to S3. And so that means that you can actually have dysfunction, let's say, a number of different nerve roots in your back that may contribute to what's considered sciatica. And to me, sciatica really is a symptom more than a condition in itself. So that means that sciatica is a symptom of something happening in your back. And that means what's happening in your back might be different than someone else's back, even though you both feel sciatica. So sciatica can happen because of compression. It can happen because of irritation of the nerve. And compression or irritation can happen for a couple reasons as well. Sometimes that is a disc bulging. Sometimes that's a disc herniation. So a bulging disc is sort of when the disc itself has moved out of its normal space, but it has not actually herniated. So that move itself can create compression or irritation around the nerve. Sometimes the disc itself actually herniates, and so that can certainly extrude disc material that then contacts or compresses the nerve. Sometimes it has nothing to do with the discs at all. It can be related to stenosis, which is where you develop bone, extra bony growth around the space where the nerve itself would then exit. Sometimes it's even outside of that, and you can have a small cyst or something in that area. So regardless of what is causing that sciatic symptom, you then have pain that goes down the leg. And usually it's on one side of the body. If it's on both sides, that can be indicative of maybe a larger space occupying lesion, whether it's a disc or bone, but that certainly can be managed as well. So when I look at sciatica, the most important thing to me is that you first figure out how you can take the stress away from the nerve. And nerve, unlike muscle, is not a contractile structure. So I often get questions everything feels really, really tight. I want to stretch it. What can I do to stretch my back? What can I do to stretch the nerve? The nerve itself actually isn't stretchy. And in fact, when being pulled on, that can be an irritating factor in your back pain on its own. So I want to show you guys something. The way that we stretch the sciatic nerve is by being in what I like to call an L position with our body. So already being in this position where I'm sitting up fairly tall with my legs straight, I'm putting a little bit of stress on the sciatic nerve. I can increase that stress by flexing my feet, and then I can increase that stress even more by bending forward. And I think you guys can test this. This is something that will probably make your symptoms quite a bit worse. And so when we look at the management of sciatica, we want to avoid positions that look like this. And I show you this because it looks like a lot of things in our day-to-day life. This could be sitting on the couch at the end of the day, watching TV. This could be stretching your hamstrings. This could even be, if you sort of readjust, the position of bending over. So we're going to go over in this class today how to modify those positions so that you do not put stress on the sciatic nerve. That being said, I would recommend not trying to stretch your hamstrings. So even though it feels tight in the back of your legs, it's very hard to separate the nerve from the muscle. And like I said, that nerve does not like to be pulled on. So we're going to go over what kinds of movements are good to manage sciatica, but I want to show you first one that I get questions about all the time that I would try and avoid, especially in the more acute phases of having sciatica. Now, that doesn't mean you can't go back to doing those things over time, but when your symptoms are irritable, you want to be sensitive around those positions that look like an L. And so I think as you go throughout your day, you may notice other times when your body is set up in that sort of L shape, you can simply modify by just bending your knees. And we'll go through that in our class today. So we're going to get started into the movement-based part of our program. We'll go over a couple of principles of how you can move to be safer for your back. So I'd like, if you guys are just joining in, to have some space to lie down, a mat, a towel, or a blanket, and then have a small pillow handy. So we're going to set up lying down on our backs with your pillow next to you to start, and resting all the way down. So one of the things that happens over the course of the day is compression in our spine, and that's normal because we're animals that stand up. We get compression from gravity through the top of our head that compresses our spine. With sciatica, that can actually increase our symptoms as well. So if we're already dealing with some compression and then gravity adds to that compression, you may get symptoms that worsen over the course of the day. We're going to take our pillows, lift our hips up, and place it underneath our hips. And I really say under your hips, not your lower back. Your lower back actually should be sort of free on the mat with your knees bent, and you just rest down. So by simply elevating our hips just a little bit, we can decompress our spine just laying here. And in fact, even laying flat on the ground is less compression than sitting up or standing up. So if you don't have a pillow, you could just lie flat. But in this position, because of the change of orientation of our spine, this should already help with the decompression of our spinal column. So we're just going to hang out here for a moment like this, but while we're in this position, we'll also look at our breathing. And so our breathing is very important to how we're able to use our abdominal muscles to support our spine. So we'll rest our hands right down on our trunk, and I want you to try and breathe in a three-dimensional way. So if you imagine your trunk like a cylinder, you imagine that cylinder lifting from all angles. And I think as you practice this, especially if it's the first time you've done this today, it can be actually tricky to get that expansion as much as you think you can. So very gentle, take those inhale breaths in through your nose and exhale out through your mouth. So as you're inhaling, you're feeling the expansion of that cylinder. And as you're exhaling, you'll feel the closure and narrowing of that cylinder. Again, try a big inhale to expand and an exhale to let it go. Try 2 more gentle breaths like this. Exhale, let it go. Good, and 1 more time, big inhale breath. And exhale to let it go. Now you could certainly spend more time in this position if this is something that's already helping your back. For the purposes of this class, we're going to move along so we can get through some other things, but keep this in mind if this is something that's helping you already. So we're going to remove that pillow. We'll just set it off to the side, and we're going to work into some core strengthening. Now, I want to go over a common misconception when it comes to core strengthening. I hear from time to time that in order to strengthen your core, you have to press your whole back, smush it to the mat. That is not true. And in fact, during sciatica symptoms, that may actually make your symptoms a little bit worse. So we're going to strengthen the core in what's called a neutral spine. And a neutral spine follows the natural curve of your back, meaning your neutral spine will look different than mine. It will look different than your neighbor's. So if you can imagine what the normal curve of your low back is, that will leave a small space under your low back, but that will not have any space under your rib cage because our spine makes that natural S curve. There should not be space under your ribs, but there may be a small space under your low back. The other way you can check is by holding the sides of your pelvis. And if you feel the bones on the front of your pelvis and the back of your pelvis, they should both be parallel to the floor. So you can actually tip your pelvis around a little bit to sort of feel where that neutral position is. Once you have found your neutral spine, the goal is to hold it. That's our spine's most natural, comfortable position. So we're going to rest our hands right on top of our trunk so you can feel that that position does not change, and lift our legs up to a tabletop. So right away, you may have noticed maybe your rib cage left the mat. See if you can press your rib cage down, but without also pressing the low back down. And that's tricky. If this is new for you, this can be hard. It takes a little bit of practice. From here, we're going to start to extend one leg out towards the center of the room at a time. Now, if you feel as you're doing this that you are losing that neutral spine, try pressing your legs up a little bit higher. And it doesn't have to be a big press. You don't even have to get your legs straight. If this is feeling really easy, you can try pressing your legs down a little bit lower. And so your goal here, of course, is to feel your core working to help keep your spine still, but also to stay in the neutral spine. And I hope you guys can see that even though you're not smushing your back down to the mat, you can still feel your core working. And this is actually our most natural position to work our deeper abdominal muscles. We'll try 3 more, and 2 more, and 1 more time. Good, and place your feet down, take a quick rest. I'm going to show you guys one other core exercise that you can do here that works on the stability of your spine. And when we think about sciatica, stability is important because it will keep our spine still from shifting around into those positions that might make your symptoms a little bit worse. So the second one looks very similar. We're going to find our neutral spine, lift both legs up. This time you're going to keep your knees bent and just drop your thigh away from your body as though you're going to tap your heel to the floor. Now, you don't actually have to get your heel to the floor. You're only lowering your thigh away as far as you can keep your neutral spine position. So for me, I feel on my left side, this is a little bit trickier. If I go past that point, then my rib cage lifts off the mat. So that's going a little bit too far. And this can be really small, but a surprising amount of work. Good. Just make sure you're breathing here. There's no right or wrong. The only wrong would be to be holding your breath here. Good. Last time. And then go ahead and place your feet down. So that's another thing we'll talk about a bit more when we get to the squatting part of this class. But holding your breath increases the pressure in your intra-abdominal cavity. So if you were to already have some sort of bulging disc or herniated disc, that increased pressure could make your symptoms a little bit worse. So from here, we're going to walk our heels in nice and close towards our bottom and prepare for bridging. So bridging is a common exercise used to strengthen our glutes, our butt muscles, and they support our spine when we're walking, when we're bending over, and definitely when we're squatting. The goal to do bridges with sciatica is to keep your neutral spine. So that means that the space between your ribs and hips does not change. So as we lift our hips up and we lower our hips down, we're keeping our spine position exactly the same. What's creating the movement is our hip joint, and that comes from our glutes. So see if you can kind of keep your fingers right on your trunk to notice if you start to roll your spine up as opposed to keeping that nice flat hip lift. And you may not be able to get quite as high. That's okay. I want you to work within what's comfortable for your body, but just test that out. And like I said, this should be an exercise for your glute muscles. If you're not sure if they're working, check. Use your hands on your glutes. You may even find that one side is working, but the other is not. So giving your brain that little bit of extra feedback by giving it some tactile sensation, that can certainly help here. Good. Try 3 more. And 2 more. And last time, drop down. You're going to roll to your side and press yourself on up to a seated position. From here, we're going to go right into an all fours setup. And so if you have any knee sensitivity, you can grab your pillow and place it underneath your knees. And then we'll come setting up with our hands underneath our shoulders, knees underneath our hips, in a nice, long, neutral spine position. So from here, we're going to work through a few cat-cows. But I want you guys to focus in on trying to create the movement from your rib cage. And that's going to help us to create spine mobility in our whole spine, not just in our low back. So from here, rounding your spine, letting your head drop down, and then dropping your spine towards the floor, lifting your head. So very gentle. You can make this as big or as small as you feel comfortable. It should not be painful. It should just feel like a gentle stretch of our spine. So we also look at gentle spine mobility when it comes to sciatica, because the better mobility each individual vertebrae has, the less overall stress it is to one particular vertebrae. So let's say we had a problem at L5, we could eliminate stress around L5 by making all our other vertebrae above and below that move a little bit better. So that is our goal with this gentle stretch here. It also feels nice for our upper back to create some movement. We'll try 2 more. Good. And 1 more time. Very nice. From here, we're going to lie down right onto our stomach. So you can walk your hands forward, rest down onto your stomach. If lying on your stomach is sensitive for your back, you can place a pillow underneath your hips. We'll open up the feet a little bit wider than hip distance and place your hands down underneath your shoulders. Okay, so from here, very gently, we're going to start to lift our spine. And you may feel comfortable lifting only your upper back. If you feel comfortable lifting up and pressing all the way into your low back, you can go ahead and do so here. So nice and easy, we're just going to start to lift and then lower the spine. And as you work into this, you may get a bigger range of motion, and that's excellent. So I like this stretch for many, many sciatica cases. Not all sciatica cases will feel good with this stretch, and if you don't, you can always make it smaller. But oftentimes, this stretching into extension can actually help to open up the space where the sciatic nerve leaves your spine. And so this is the opposite position of how we spend most of our day sitting. So if this is one that feels good for you, keep it in mind. It's a really good bang for your buck that is quick and relatively easy, but very effective at keeping our spine flexible in a good orientation for sciatica. Good. We'll try just 2 more like this, nice and easy. And last time here. We're going to push back up to an all fours position and then sit down on our left hip with your legs splayed off to the side. If this seated position is really uncomfortable, you can always sit up on a pillow or just change the orientation of your legs. So I want you guys to find a comfortable position, but be biased somewhat to the left hip. From here, we're going to open up our arms. So we've moved our spine to mobilize a little bit backwards. We're now going to gently mobilize our spine sideways. And I want you guys to really pay attention to how your back feels. This should not be painful. And it may be this case that you don't have a lot of range of motion going to one side. That's okay. I want you to make it small, even if you can only move a couple of inches. I want this to be comfortable. And I hope as we do a little bit of this sideways movement that your spine starts to loosen up here. We'll try just one more like this, and then pause with your left arm down and your right arm over your head. From here, we're going to rotate and turn our chest to tap our right hand to the floor and then open back up to the ceiling. Now, this is a big rotation movement. And sometimes rotation can be irritating for our low back or sciatica. However, this kind of rotation is actually oriented to the thoracic spine, and our sciatic nerve starts down in the lumbar spine. So this should be a relatively safe rotation stretch to keep your back flexible without being very irritating to that sciatic nerve. We'll do one more time just like this. Good, and then open back up. Okay, now while I have you in this sideways position, we're gonna try a modified side plank. And I love side planks as a way to strengthen our core without super stressing the nerve. But the other reason I like side plank is because it tells us differences from side to side. So more than likely, if you have symptoms that are worse on one side than the other, you may have some weakness associated with that as well. And it's always good to recognize that. So then perhaps you spend a little bit more time on your strengthening on that side. So what this will look like, we'll come down onto our left forearm, your elbow right underneath your shoulder. We're gonna keep one knee down, and that's our bottom leg. So your left knee is gonna be bent on the mat, and your right leg is gonna go out straight. From here, we'll lift our hips into a side plank. If you need to drop down and take a rest and just hold this shortened side plank, that's fine, but give it a try. And you want to try and stack your hips, push your elbow down into the floor. Notice if you're actually overhiking your hips. You actually want a straight line from your shoulder, hip to knee, and just hold it. And even in this modified side plank position, it should be some work for your bottom hip and your bottom core, certainly your bottom shoulder, to hold this. So we'll hold for 5, 4, 3, 2, and 1. Come on down. Awesome. So you guys can certainly hold that, go back to that one a little bit later, but mostly I'm showing you this today so you can notice the difference when we now do the other side. So we'll first swing our legs to the right, sitting down on our right hip. This side may be different. If you want to grab that pillow, place it underneath your hips, you can do so here. Open up your arms, take up space, and then we'll start with that gentle side bending, side to side. Good. And again, this is a different side. You may feel more or less restricted. Just work within what's comfortable for your body. And I promise you that you don't have to stress yourself or put yourself into pain to get better. In fact, our nerves will tell us when they don't like what we're doing. And this is one of those times when you want to listen to your body and notice what your body is telling you and see if you can make a change. We'll pause when our right arm is down and our left arm is up in the air. From here, we're going to rotate, tap our left hand towards the floor, and then open back up to the ceiling. You may not even quite be able to get to the floor, and that's fine, okay? You're just turning your chest as though you might tap that hand down, and you can actually follow your left hand in this case with your eyes, so also turning your head to rotate down. Good. Just 2 more on this side. That's it. And 1 more time here. And then open on up. Awesome. So we'll try that side plank. We'll lower down onto our right forearm with our elbow directly underneath our shoulder. Our right knee is going to stay down on the mat, but our left leg is going to straighten. From here, we'll lift our hips up and try just holding your plank. Your shoulders are stacked, your hips are stacked on top of one another, and you should feel the work in your bottom hip and core. Oftentimes, if you're not feeling anything, it's because you're rotated backwards. So try stacking your hips right on top of one another, and you can wiggle around a little bit until you feel that work right down into your side body. We'll hold here for 5, 4, 3, 2, and 1. Come all the way down. All right, nice work, guys. So we're gonna finish our class with the movement part in standing. So I'd like everyone to come to a standing position. I'm just gonna adjust my camera a little bit so you guys have a better view here. So we talked about that idea of decompression, of minimizing the amount of compressive force in our spine. And we can make a change even in how we stand. So we spend a decent amount of our day standing. And if we're kind of standing in this slumpy position, you guys can probably see how that creates compression in our spine. So just with imagery, we're going to change that by imagining pushing our feet into the floor. So we're pushing our feet down, but at the same time, I want you to think of lifting your own rib cage up off your hips. And so by doing that, we're pushing down with our legs, up with our rib cage. We're creating space in that cylinder. So even if you could feel a little bit of symptoms, I just want you to notice what that feels like to really stand up tall and actively push your feet into the floor while lifting your rib cage up. And just hang out there. This is a little exercise you can practice even when you're waiting in line at the grocery store, maybe to go into a store, creating that space. Now we're also going to use that to practice how to bend over and how to squat. So I showed you early in class, bending like this is quite stressful to the sciatic nerve. So we're going to bend instead using our hip joint. So we're creating that length. We're in our neutral spine position, and we're going to start bending our hips backwards, then our knees, press our hips forward, and stand up tall. Bend your hips backwards, then your knees, and hips forward, and stand up tall. So just by making our hips shift back first, it's okay for our chest to tip forward because the actual shape of our spine is not changing. I'm not tipping forward and rounding. I'm keeping this nice flat back position that we know works pretty well for sciatica. So this can take a little bit of practice. This is what's called a hip hinge, but this is the way we can use our hips instead of using our backs to do bending tasks, to bend over, to pick something up, and to lift. Okay, so I'm going to take a quick peek here at everybody's form. You guys can practice that. Good. That looks awesome, Karen. Good. Allison, lift your rib cage away from the floor a little bit. That means when you drop down, your back is a little bit too arched. So you want to keep your ribs lifted from the floor when you then stand up. Good. Okay, so that concludes our movement part of the class. But one thing I want to talk about as you guys are being proactive in managing your sciatica and managing your back pain is this idea of centralization. So centralization means that when your back and your sciatica symptoms are getting better, your symptoms may centralize. So if you had, let's say, pain that went all the way down your leg into your calf, it's actually a positive sign if you wake up over the next couple of days and you don't have pain in your calf, you only have it in your thigh. And then maybe the next day you don't even have it in your thigh anymore, but it's in your bottom. that idea of the pain coming back to its place of origin is a positive sign of recovery. But that being said, sometimes the pain in its point of origin, which is your back, might get a little bit worse. So it's not abnormal to no longer have sciatic symptoms, but have worse back pain for a little while. That's actually still a good sign if you're not having pain all the way down into your feet, but it's more focal to your back. That too will resolve. That's still a good sign of recovery. So I always like to mention that at the end of class as you guys start to work on things that help to improve your symptoms. So I know we're already at the end of our time. There is so much we can talk about this, but I'd love to answer some of the questions you guys have. Since we are a nice small group for our 5-star members, if you guys would like to type them into the chat, you can do that. You're also more than welcome to unmute yourself and ask any questions that you have. If you don't mind sticking around for a moment as well, I will show you guys how to use that feedback app to leave feedback about today's program. Awesome question from Kay. So should the exercises be conducted every day to prevent episodes? Yes, I think so, but sort of with a little caveat that these exercises are the most important on days when you are inactive. So let's say you have to sit for work for 8 hours out of your day. You definitely want to get some of these back movements into your day. If it's a day when you're a little bit more active, maybe it's a weekend, you're out hiking or walking, doing things with your friends and family, you may not need these as much. I always try and use your symptoms as a guide that if things are bothering you, these are things you can do to help it. But sometimes you want to stay ahead of that. And if you want to get ahead of having your symptoms, this could be a good routine to even start your day with. So when we do things lying on the back, my neck was uncomfortable. Can we use a pillow under our neck? Absolutely. So we don't get into the neck a lot with this class. I do offer a class later today that's all about neck and shoulder pain. But if you're more comfortable having a pillow under your head, absolutely, that's fine. Another good question here, is it safe to do these exercises while you're having an episode? Absolutely, as long as you are using your symptoms as a guide. So if you are having active sciatica and going deeper into a stretch makes it worse, back off a little bit. You can do these stretches maybe in a smaller range of motion or with less repetition and still get the benefit from it. And that may change from day to day, but you can definitely do these things. If anything, they should help while you're actively having symptoms. Another question here, any concerns for someone who has had spinal surgery? Certainly every spinal surgery is different. So you want to make sure your surgeon would give you precautions to say maybe do or don't do these things. But almost all spinal surgeries should be fine to do these movements, especially if your surgeon has not given you any sort of precautions. So I think if you're having questions, it's worth consulting with a physical therapist who can maybe read over your surgical report just to make sure. But almost all spine surgeries should be very safe. The things we did today were quite gentle, and you just may need to modify your range of motion a little bit.